Hi, my name is Wendy, and today I'm going to be presenting a bacterium called Rickettsia rickettsii. Basically, Rickettsia rickettsii, it is an obligated intracellular gram-negative bacteria. And this is a picture of a rickettsia. Basically, what it is just a tick-borne pathogen. And you know a lot of times ticks are on animals where there's more than one kind of tick, and Rickettsia rickettsii is one of these kinds of ticks. It has several different names. You can see here's the Rocky Mountain spotted fever in the U.S., and we also have a name for it in Brazil. They also have a different name for it in Colombia and also in Mexico. So this disease is actually worldwide. It's not just limited to the United States. Some background information. It was first identified in 1896. It's quite some time ago. But the first available test for it was in 1921. And still today, I believe they're still performing this test. It is normally in the Western Hemisphere of the United States. It is also considered to be an emergent pathogen, which the CDC has cloned it a classified B, which is actually a bioterrorism, which once it infects, it could infect a lot of people and it could get pretty bad. And here's a map of basically where you would see the most populated area of this disease. People in this part of the hemisphere are most likely to come in contact with this tick-borne pathogen. Some different ways that the tick can infect us. The tick actually, once it infects us, it can feed on us for 1 to 2 weeks. That's a long time. And then it's also injected through their salivary glands. So when they bite us, their salivary glands releases this toxin into our bloodstream. And through our bloodstream, from 1 to 2 weeks, it's just feeding off our good blood. And there's also been some instances where it was contacted through aerosol, which is just basically a spray. And so far, there's only one incident where it was contacted by a blood-borne blood transfusion. Just like AIDS and HIV, sometimes we have infected blood and it's transfused into somebody, and within that transfusion was this Rickettsia rickettsii. Okay, the most at-risk population, as you can see, is the residents in the rural area. The urban population, where it's exposed to open spaces, like if you have lots of parks, wooded area, campgrounds, those areas will probably have the most incidents where there is this tick-borne pathogen. Animal care workers, since ticks are on animals, they are at risk for contacting this disease. And then we have age group, children from ages 5 to 9. Since kids are most likely the ones outside playing in these areas, they're the ones most likely to contact it. And they're not going to know that they just got bit by a tick. They probably think it's an ant. They're not going to know how to check themselves to see what just bit them. And also, men get it more often than women. Since men are mostly outdoorsy and women like to stay inside, I can see why the men population would contact it before the female population. And also people from older than the age of 40. So those people up there in age, they can contact this disease as well. And here you can see a demographic of the ages. As you can see, it starts going up the older that you get. You can see, so we're all at risk for this disease. Okay, some diagnoses and testings that have been performed, there's not many, is the complement fixation test. We also have an IFA test, which is an immunofluorescent assay, which is just, all of these are pretty much blood tests. Then we have the latex agglutination test, the EIA test, the Western blot, and the NAT test. So all these tests are basically performed in the laboratory. They draw your blood and they'll see if you have that. They'll isolate these cells and see if you have this rickettsial. And that's how they will know, hey, how do we treat this disease? Hey, they have this. Let's go ahead and inform the CDC that we have this open case. Signs and symptoms to look for. They're very genetic because a lot of times these signs and symptoms could be indication of anything. You won't really know if you actually have this infection until you are tested. You can have a fever, you can have a headache, you can have a rash, nausea, vomiting, stomach pain, muscle pain, and lack of appetite. All those are indications of pneumonia or just a stomach bug. All these can be, that's why a lot of times this disease is not caught in time because we don't know exactly what it is because it's fairly new to us. And this is a picture of a rash. They come in some red blotchy areas, and also they can also be pinpoint dots. So you'll see this area. And also I meant to mention that a lot of times when this disease gets this bad and there is the medication that they have prescribed is not working, amputation is also an option. So a lot of times people's limbs get amputated, their hands, their feet, their fingers, and their toes, because you see how it looks now. It can get worse. Right now, the best defense for this disease is a tetracycline called doxycycline. It is an antibiotic and it is prescribed from your physician. So once you're diagnosed with that, they will immediately put you on this regimen so they can see if they can help combat this infection before it gets to the point to where you have to get an amputation. Here are some preventions. Now that we know about the disease, we know where it is, we know the high-risk population, we know how to contact it, let's try to prevent ourselves from getting it. So when you're going outside, because you know they like grassy, brushy, wooded areas. So when you're going outside, there is this spray called a permethrin that you can spray on your clothing, you can spray it on your boots, you can spray it on your camping gear. That will help detect them from attaching to those items. And the good thing about that is once you wash it, it will stay on your clothing for a few days, so you don't have to keep putting it on. Like 1 or 2 washes is still good. And then also when you go inside, before you go inside, make sure you check your clothing. If you see any of these ticks on your clothing, just go ahead and pull them off. And also you need to check your skin. You need to check under your arms. You need to check behind your knees. You need to check your belly button. You need to check in and around your ear, in and around your hair, because this is where these bugs like to attach and they like to feed. And what else? Okay, and that is the end of the presentation. Now that we know a little bit about rickettsial, we can know better how to arm a defense and fight against it. Thank you.